All right, it is Monday at 4 o'clock. Time for our COVID update, specifically focused on the Delta variant. Today's top lines are that it appears that new cases are not only plateauing, but we may be seeing a decrease. Decrease in cases, decrease in the positivity rate, decrease in folks in the hospital with COVID. That's the good news. The tough news is we are still seeing far too many deaths, with 85 combined deaths between Saturday, Sunday, and today. So to quickly run through cases, on Saturday, 3,171 new cases, 37 deaths. On Sunday, 1,563 new cases, 31 new deaths. Today, 1,729 new cases, 19 new deaths, now at a positivity rate of 10.55%. Now, the positivity rate does appear to be inching down just about every day, but let's remember over 10 is still a place we do not want to be. I also want to remind people that this strain is killing more and more younger Kentuckians, primarily unvaccinated Kentuckians. So if you are in your 30s or in your 40s, in your 20s or below, you do need to get vaccinated as quickly as possible. On Saturday, our report included a 39-year-old woman from Bell County, a 47-year-old man from Bullock County, a 46-year-old man from Floyd County, and a 42-year-old man from Harlan County. Sunday's report, similar, 45-year-old man from Elliott County, 32-year-old man from Harlan County, 44-year-old man from Hopkins County, 46-year-old man from Madison County. So younger Kentuckians losing their life to the Delta variant all across the Commonwealth. And remember, it can hit communities really hard. Sunday's report had 4 separate deaths from Letcher County, all of which have occurred in September. So please get vaccinated. It's critically important. This thing is deadlier than anything we have ever seen. And remember, deaths trail cases. And so we are going to see at least a couple of very tough weeks. Let's look at our overall trends, our stair-stepper chart. As you can see, this last week does show a decline from really the 3 previous weeks. What we'll want to see is what this next week brings to see how steep our decline is, or whether or not we reach a new plateau, which happened in many of our other surges. It's a good sign. The case numbers are going down. We do need them to go down a lot faster, though. Remember, even at 22,560 cases, which is a great improvement from when we had over 30,000, it's still one of the higher weeks that we have had in the course of this pandemic. And that number of cases still creates challenges for our hospitals. We could see this continue to go down, especially at the rate between last week and this week. It'll be good for Kentucky. Again, this shows it a little differently. This is just this surge. Remember, the up and down week was Labor Day, and we don't think that we think that the holiday threw off the data a little bit, but at this point, worst case is plateau, best case is decline, and we hope we will see that week over week. The positivity rate shows the same. Again, we are way too high on our positivity rate, but we like to see it going down, and each day we've seen it go down at least just a little bit. This is typically the leading indicator. If you want to show the next one, this shows in a little more graphic detail the decline that we are seeing in positivity. Next one, we hope continues at this rate, but that's the inpatient census. That is the real decline we have to see with our hospitals hit as hard as they have been. Remember, a couple of states to our south saw a little bit of a decline and a spike again. There's nothing suggesting that's the case here, but we got to keep up the work in vaccinating, the work in masking. That's how we ensure that line continues to decrease. ICU census is a little more troubling. It's not that line moving downwards like we saw in the inpatient. It's still at way too high of a level. This still has regional hospitals and others using emergency rooms as ICUs, and ultimately having people on ventilators in hospitals that don't normally have people on ventilators. And then as we look at our ventilator census, want to see what the next couple days bring. Sometimes right at the end of the week, based on reporting, we see a decreased number. But again, if we can see this number go down, that suggests we will lose fewer people as we move forward. Our hospitals and where we are today, 104 ICU beds currently available in the Commonwealth, at least 16 kids in the hospital with COVID, 6 in the ICU, 5 on ventilators, 68 of our 96 hospitals reporting critical staffing shortages. As a reminder, support we're providing to our hospitals out there. First, National Guard support. And I can't tell you how positive the feedback is on how incredible the Guardsmen are, how they lift the spirits in the hospital, how it has, even from the very first moment, this response in people that have been working for 18 months that is so positive and that people can feel, and how hard this group works, always looking for that next thing that they can do. So currently we have over 500 National Guard members at 27 area hospitals offering support. Schools, these are nursing schools. We also have 27 hospitals receiving support from Galen College of Nursing, EKU, WKU, JCTCS, and regional KCTCS campuses. St. Clair now receiving support from 2 separate schools, Galen and KCTCS Maysville. Testing remains the same areas. Again, this alleviates pressure on the hospitals. Do not go to the emergency room if what you need is a COVID test. And then, of course, AmeriCorps members at multiple hospitals throughout the Commonwealth setting a model that nationally they are looking to replicate. So I stood here in recent weeks and discussed the importance of testing. Not only getting tested, but finding locations in your community outside of hospitals for when you or a loved one needs to get tested. Because of this, we have repartnered with organizations like Gravity Diagnostics and Wild Health for drive-through testing locations across the Commonwealth. Today, we'll hear from Gravity's Jordan Kelsey, a clinical specialist helping to run that site in Danville that was located there to ease the pressure on Ephraim McDowell, which has gone through some really rough times, but amazing people working there through some of the most challenging conditions. This video shows how quick and easy the process is. The sites are so important to help stop the spread in our communities, and I hope when people watch this, they'll say, okay, I can get a regular test too. It doesn't take any time, and it'll help protect me and my family.
So with the recent spike of the Delta variant, it seems to be pretty contagious. So we've really had to help the communities that are in need with providing a quick, appropriate test for them so they can stay on top of this, because if they don't have testing, people are going to spread this even worse than what it's being spread currently. So this will really help alleviate that need for the local communities to get tested and really try to slow down the spread of COVID. The main thing between here and the emergency room is that we're able to provide a safer environment. You know, there could be other sick people in an emergency room, and there are people there that have real emergencies that need to be, you know, seen by the physician, the doctor immediately. Here, we're able to get people in and out really quickly and actually relieve the ER of, you know, things that they may need to take care of that don't revolve around COVID.
This site is specifically for testing. You don't have a line of other patients that are basically competing for your attention. I'm never here more than 10 minutes. You literally drive up, drive through, and get the test done, fill out some paperwork, and you're gone.
We just had all 4 of our children tested for COVID. Well, they were exposed, and so we want them to be able to go to school, and we want to be confident that they're not sick, and we're not going to give it to any of our family members, and so we just went ahead and got them tested.
We get results back in 24 hours. Other clinics, you're looking at 2 to 3 days a lot of times.
We appreciate the help of all of our partners, and I'm going to show my kids that video for how to be brave when getting tested. Moving to vaccines, remember, vaccinations are the way we defeat COVID once and for all. Over the weekend, 16,537 new Kentuckians got their first shot of hope. That brings us now to 2,688,829 Kentuckians. So of all Kentuckians across the Commonwealth, that's 60%. 60% of everybody who lives in Kentucky has gotten at least one shot. Of those that are eligible, that's 12 and older. Every time we increase a percent here, it is a big deal, and we did. Now up to 71%. Originally, we thought that this could start moving us towards herd immunity. Obviously, the Delta variant is more aggressive, and it's going to take more. 18 and up. These are folks that get to make their own choice. Also up a percent to 73%. So those are all good things. Yes, we got to get a lot more people vaccinated. But to be able to do this in the time period that we have is something that we ought to be proud, but certainly not satisfied with. But the next one we're going to put up, I'm incredibly excited about. 65 and up. Remember, this was 91%. We talked about how hard it is to move when there was only 9% of that age group left that hadn't been vaccinated. We are now up to 92%. Every percentage point that we claw for in this age group protects the most vulnerable among us. And we're going to talk about booster shots here at the end. So that is a good sign. 50 to 64, still 80%. 40 to 49 just moved up to 70%, up 1 percentage point. That's my demographic. Keep going. Remember, 100% of people aged 40 to 49 are eligible. I know some have medical conditions, but we can do more. We can do better. Let's not let our parents beat us. So go out there and get vaccinated. 30 to 39, proud of this one, up 1% as well. And then we hit our 2 age groups where we're seeing the most infection and the most spread, 18 to 29 and 12 to 17, neither which have moved again. This is the area where over half or close to half of everyone in this age group has not been vaccinated. So folks, please, if you are 12 to 29, go out there and get the shot. We're losing people in that age group, but remember, it's not just if you're going to die of an illness, it's if it's going to make you incredibly sick, if it's going to have long-lasting implications, if you can spread it to someone else that you love that would get really sick. So please get vaccinated. We also show vaccinations geographically. We've moved our thresholds because we got to do better to over 50% and over 60% now. So new to the over 50% group is Hopkins and Grant counties. You want to be in the blue in this graph, and as you see, more and more are getting there. Now, let's look at the over 60% because really we need to be even higher than that. All right, we're going to change the colors the next time we do this. This is the first time we've shown this because the last graph, you wanted to be in the blue. And in this graph, You don't want to be in the blue. And that is more confusing than it should be. But we are going to do better. So of those that are above 60%, great job. Again, continue to do more. But they are Anderson, Boyle, Perry, Scott, Jefferson, Kenton, Boone, Campbell, Fayette, Franklin, and Woodford. And here is how aggressive the Delta variant is. Perry County has been hit really hard. A lot of people very sick, and they jumped out of the gates in vaccinations like a rocket. At one point, leading even the state at different times. But this shows you that 60 is not enough. I don't think anybody wants to live through what they're living through in so many other areas right now, but I'm proud of them at how hard they have worked in that county. Keep it up. That's to the mayor, to Judge Alexander. Keep it up. All right, some good news today. More help on the way from the federal government. Beginning today, the federal government will be sending teams to assist with monoclonal antibody injections. A team of 3 RNs, nurses, arrived today at Baptist Health Corbin, actually came 2 days early. We're expecting additional teams for Highlands ARH Regional Medical Center in Floyd County and the primary care centers of Eastern Kentucky on September the 29th. Teams will consist of 2 to 4 RNs and or paramedics. Taylor Regional Hospital in Campbellsville and Middlesboro ARH Hospital in Middlesboro should receive teams on October the 1st. Basically, these are trained folks from the federal government that are going to come in and are going to take over doing those monoclonal antibody treatments. That frees up, just like we do with testing and the guard and the nursing student, it frees up other people in those hospitals to tend to patients. This Thursday, we're going to have our website up showing everywhere. It's going to be 50 plus locations that you can get monoclonal antibodies. It's going to meet the legislature's requirement that we assist in setting those up, and that they will be in each and every area development district. Now, there is not going to be enough, though Kentucky is doing better than the original allocations we believed we would receive. We have been aggressive. We've argued our cause. Department of Public Health and others have pushed, and we are receiving more than the original ration that we thought we would receive. Now, over time, that probably won't be the case. And at our current rates of infection, there still will likely not be enough for everybody. But I did want to give credit to our folks, our hospital folks that are pushing, DPH, which is pushing, really making a strong case for Kentucky and why it is so important. We get caught up sometimes in politics and in the federal government. They sent us now 5 EMS strike teams, 2 separate medical strike teams at different times. Now all of these monoclonal antibody strike teams, as well as paying for everything we do with the National Guard and a number of other steps. So we are greatly appreciated of them. Remember, Delta variant and COVID doesn't care your party, doesn't care red or blue, it just wants to kill you. And let's make sure that we know our adversary is not each other. It's a 1 in every 100-year virus that has already killed over, 600,000+ people. Maybe we're closer to 800,000 people in the United States, certainly over 8,000 Kentuckians. The enemy is clear. It's not us, it's the virus. All right, and last, booster shot updates. I know this has been a little confusing. Certainly there has been White House initiative. There's been the FDA advisory group, the CDC's group, and then ultimately the CDC director herself. None of these calls are easy, none of them. And no group is constructed in the exact way that you would need in a pandemic, right? You have sometimes practitioners, sometimes you have academics and others. But in a pandemic that's killed this many folks, sometimes you got to make decisions with urgency too. So what I want to do is make sure we clear up any confusion that's out there, let you know who can get the boosters, and if you are eligible, go get them. There's plenty of boosters out there. We actually have enough to where if they come out and approve kids, which we hope will happen 5 to 11 sometime soon, we have enough for that. We have enough for boosters, and we have enough for everybody out there that hadn't gotten their first shot. So go on kycovid19.ky.gov. You can get an appointment tomorrow to get a vaccine. So who needs a booster dose? Let's start out with those that are have weakened immune systems. We sometimes call immunocompromised. This applies to two separate vaccines, and this is the only one that does. So if you got Pfizer or Moderna and you have a weakened immune system and you got your second shot, remember, because these are 2-shot vaccines, so a booster is a third shot. So if you have gotten 2 shots of Pfizer or 2 shots of Moderna and you have a weakened immune system, doesn't matter how old you are, go get your booster. It needs to be 28 days after your second shot, but you should go get it. If you're undergoing cancer treatment, if you are on immunosuppressants, if you have major health conditions that your doctor says means that you should get this, then go get it. This is, you're concerned about your immune system. And again, either Pfizer or Moderna for this one. And this is the only one. The boosters we're going to talk about next, which are third shots for a broader population, are only Pfizer. They are only if you got Pfizer. If you got J&J, first of all, there is no second or third shot at the moment. They're working on it, and they need to. If you got Moderna, only approved thus far if you are immunocompromised. Now, if you're waiting on that third shot, if you're not for Moderna, I get it. But Moderna right now is proving to be the most effective vaccine, even against the Delta variant. So hold on, give it the time, and we will get there. All right, so we went over Pfizer and Moderna. If you have a weakened immune system and it's been 28 days since your second shot, go get your third shot. All you'll have to do is check a box. All right, now for everybody out there that got the Pfizer vaccine and you have gotten both doses, the first shot and 3 weeks later, the second shot. All right, so if your second shot was 6 months ago, and again, you took the Pfizer vaccine, you can and should go get your third shot if you are 65 years and older. So I want to start that again. If you got Pfizer and you're over 65 and it's been 6 months since your second shot, go get the third dose. If you're living in a long-term care facility, we've already proved you here in the Commonwealth. We did that on the weekend immune system for skilled nursing, but certainly assisted living ought to be on this one as well. So those are the absolutes, right? And we believe strongly that you should go get the third dose, 65 and up, again, Pfizer, and it's been 6 months since your second shot. Now, if you are 50 to 64 and you have any medical condition that puts you at risk at COVID, remember, heart, lung, kidney disease, if your BMI is over a certain level, then yes, you ought to go get it too. So if you got Pfizer and you've gotten both of your first 2 shots and it's been 6 months, you're 50 to 64 and you have any of these health conditions, then go and get that third shot. All right. Now, finally, again, on Pfizer, if you received Pfizer vaccine and you've gotten your first 2 doses and it has been 6 months since your second dose and you are 18 to 49 and you have any medical condition, again, then you can get your third dose of Pfizer. That is a permissive recommendation. It was a little different in how the CDC put that out there. But again, if you have diabetes, heart disease, kidney disease, you will be eligible only if you got Pfizer. And then if you have a job where you are exposed to large numbers of people and would be at a heightened risk of infection, this is what the CDC director authorized that was argued between different groups. I agree with this recommendation. I'll just point out 2. Healthcare, 3. Frontline workers, education. We think those are all areas where if you had Pfizer and you've gotten your first 2 shots and it's been 6 months, go get another one. You're exposed to a lot of people. And finally, if you're living in a congregate care setting, again, this could be assisted living. Nursing homes have already done that, but if you live in congregate care settings, we think you know it. So again, that is Pfizer. Finally, just to be clear, if you got J&J, let's go to the last one. There's no booster dose at all right now. They're working on it, and I believe that if you got J&J, you're going to need a booster. But we expect in weeks at least, at most, to get the Moderna, if not the J&J booster. So I know that was probably painful. I know we went through it and talked about all the different pieces, but I want to make sure that there's no confusion on this, and that'll all be on the website. You can talk that through with your doctor, but if you qualify, we really believe that you ought to get this booster, but per the guidelines. I'll just do it one more time. Pfizer and Moderna. If you got your first 2 doses and you're immunocompromised, then you want to get that booster at the right time. All the rest is just for Pfizer recipients. And again, all of that will be up on the website. All right, with that, and because I have a parent-teacher conference here coming up in a little bit, we're going to turn it over to questions. And I'm not sure the last time we did that in under 30 minutes. So to celebrate, Tom Latek from Kentucky Today.
All right, what a way to celebrate that. Can you tell me the purpose of the stage and all the other things that are out on the front of the Capitol? What are we going to see there, and when are we going to see it?
There is a stage being constructed at the front of the Capitol. I cannot comment on its purpose yet, but I would say stay tuned. It is incredibly exciting, and folks are going to know about it very, very soon. Going to be historic. Chad.
Really fast, in terms of the booster shots, we talked to some health departments today who said that they were waiting for guidance from you all before they started rolling out. Are they getting that today? And then also going back to the younger demographics of vaccination rates, what's the plan to try to reach out to them in those age groups?
Well, for the younger demographics, one thing we focus on a lot is schools, and our schools are making a real strong effort to get there. We're also working on ways to communicate directly to them. That's a lot more digital advertising than others, and trying to get folks to be able to tell their story directly. And what was the first one?
In terms of getting the info to the...
Yes, the info should be getting out to all the local health departments. Hopefully this clarified it for each of them, and these boosters can get out there. I know that it also had to go through a process for some of the major providers, your Kroger, your CVS, your others, but we believe those are up and running because we don't want people to wait if they qualify. Mike.
A couple questions. First, just curious, are your parents receiving the booster dose?
My parents, I anticipate, will receive the booster dose. If they haven't already, they haven't. We haven't had that conversation yet.
And then second, as far as the 18 through 49 range is concerned, are providers expected to vet and figure out who qualifies? Say, if you go to a CVS and say, I work in a setting where COVID could be an issue.
I believe that if you go in right now to get your booster, it's going to primarily be the honor system, but they are going to be able to see which vaccine you previously got. So do not mix the Pfizer booster with Moderna or J&J. We will have more news soon, but that right now we believe that would be a bad idea that no one should do. And again, remember, we all got to make it through this. I don't believe there's going to be a rush on vaccines like there were before, but let's at least make sure we get those 65 and up that got the Pfizer vaccine in and able to get it. Drew.
Last week you talked about the 3 hospitals that requested the FEMA medical strike teams. Were those the 3 hospitals that were sent the monoclonal antibodies assistance, or did you get a response on those 3 requests, and have any other hospitals put in those requests since?
I don't know about new requests since those. We are on our 2nd hospital, which is ARH Hazard, that has one of those teams. I'd have to go back and compare the monoclonal teams. I don't think that they are the same. If I remember right, Taylor Regional was one that had requested the FEMA strike team and does not have a monoclonal team yet, though I think we read that they will soon. So these are all different requests that come through, but this one really helpful and exciting, and anything that we can do to try to free up space and people. But we are in daily communication with our hospitals, and they are doing an incredible job. A large part of our story coming through this are going to be the incredible men and women that showed up for twice as long as we had expected, that saw twice as much trauma as any of us could ever imagine, and kept going because they love us. All right, on the line virtually, Karen Czar. We think Karen Czar.
Hi, Governor. Can you hear me?
I can now.
Sorry. Governor, based on the current trends, knowing that things could change tomorrow, how long do you anticipate that hospitals are going to need extra assistance? And also, in the interviews I've done recently, there's been a huge spread between, obviously we talk about unvaccinated and vaccinated, but there's also a spread between unvaccinated, vaccinated, and those who have only gotten 1 dose. Are there any campaign plans to reach the people who have only gotten that 1st dose and need their 2nd? Thank you.
We're constantly refining our communications and indeed working on what the legislature asked us to do as well. But you are right that the Delta variant is first of all hitting fully unvaccinated people the hardest, but then they are hitting partially vaccinated people the next hardest. And when you think about which vaccines have proven the most effective versus the Delta variant, you can definitely see the difference there. It is really hard to predict COVID and the variants that are out there. I certainly anticipate that our hospitals will need help to some degree for the next 30 days, which hospitals, when and where can move, but I certainly don't anticipate a shorter timeline than that, because when we look, the sickness follows the cases and the deaths follow the sickness, and we're still seeing hospitals that are having a rough time. So we're going to stay with them to make sure we're providing all the help we can. But I would think, the next month is still going to be very tough, but we really hope it continues to decrease like we are seeing. That's a silver lining. Corinne Boyer.
Hi, Governor. Sort of following up with Karen's question, even after COVID is under control, do you imagine, because of the staffing shortages, that more assistance from like the National Guard will be needed just to sort of fill those positions that are still open?
Well, once COVID is under control, I don't anticipate that we will need regular assistance from the National Guard. But what we are going to need are changes. Changes in some of our regulatory schemes, changes in a number of our approaches, especially dealing with the nursing shortage. Before COVID, we had, I think, 6,000 openings that pay on average, about $50,000, more than 1,000 of those spots available in Eastern Kentucky that we could fill with folks from Eastern Kentucky. So we're going to have to see some significant changes on the state level. I believe we're committed to it, and the legislature is committed to it. So we're going to have a number of new initiatives to make sure that ultimately our hospitals can get the assistance that they need. There can be short term with that. It could be regular recognition of those trained and licensed out of state. Could include more foreign-born nurses and doctors. And then it's more long-term. We've got to have more spots open in our nursing programs. We've got to be graduating more people from them, and we got to make it happen sooner rather than later. Sarah Ladd from the Courier-Journal.
Yeah, thank you. Kind of on a similar note, I wanted to ask, NPR put out these projections the other day showing that by next March, daily cases should be around or right under July levels. That projection was assuming that we don't get new Delta-like variants and kids' vaccinations take off. So I know like the charts you showed in the beginning of this presser made it seem like that might even be sooner than March for us if things keep going the way they're going. But just kind of wondering if we should expect a similar trajectory in Kentucky if those same assumptions happen. Thank you.
All right, so none of us have ever been up against COVID or the Delta variant before, but what we're really going to see is, how much of St. Louis versus Philadelphia. Previously, we've been St. Louis. This time, sadly, we were much more like Philadelphia. We've endured. It's burned so hot here, and we have had so many cases. If we beat those projections, that's going to be the reason. It's going to be a combination of vaccinations, but also how many people have had COVID. And then to keep from getting another surge after that, we're going to need to get those that hadn't been vaccinated, that got COVID and survived, to get vaccinated afterwards. And so a whole lot of it, we can look back on the Spanish flu and see how long different things took depending on how steep the curve in cases, positivity rate, and the like are. But I have found that these projections sometimes helpful and give us a goal, sometimes give us a false sense of security. So I'm really glad we seem to see declining cases, but I want to make sure I'm clear that they're way too high. And we gotta stay at it. We gotta wear masks. Don't start taking it off because you see cases starting to tail. We got a lot more people we need to get vaccinated. And I'm ready for that approval of 5 to 11. And when that happens, I will take my 11-year-old daughter to get vaccinated because it is safe, it is effective, it's how I protect her, and it's how we get through this. Christian Hauser, WKRC.
Good afternoon, Governor. It's actually James Pilcher with WKRC.
Oh,
how are you doing today?
Good.
Two quick questions. One, I'm sure you saw that Ohio came out with another one of its incentive programs. Is there any thought or planning into doing something like that or doing another incentive vaccination program in Kentucky? And secondly, can I get your reaction to the judge's ruling on the temporary restraining order in the St. Elizabeth's vaccination case?
All right, that's a decision where at least in the TRO stage, a federal judge said St. Elizabeth can go ahead requiring vaccinations. I think that's the law. Look at all the other required vaccinations we have, whether you're a school-aged child or whether you work in a number of other locations. I think that it's been the law for a long time. It's still the law, and how we would defeat virus is worse than this in the future without it. That could endanger the human race. So I've always believed that piece is the law, and I can never remember the first questions. Oh, vaccine incentives. We still have our tourism vaccine incentives that are going on right now, and then looking at other possibilities. I feel that our shot at 1 million and scholarships worked to stop the decline, but do want to be very thoughtful with the very hard to reach populations, whether it's really incentives at this point that work. I think I've been very open in that I think it's breaking the Thanksgiving dinner rule and asking Kentuckians and Ohioans to have tough conversations with people that they love that have not gotten vaccinated. Right now, that's what we are seeing work. And it's honestly partly because of the risk, right? That you are having that conversation because you love the person so much that you're willing to put your relationship on the line. I truly believe that that's where we are, and that people aren't going to respond to incentives as much, and they're not going to respond to governors as much. They're not even going to respond to doctors as much. But having somebody that cares about you that much take that big of a risk, I think people do respond to. And last but not least, Melissa Patrick, Kentucky Health News.
Hi, Governor. So the Washington Post's numbers show that the week-to-week vaccination rate in Kentucky dropped 11% last week. And as you well know, statewide masking remains optional. And you opened the case numbers basically saying we have to get these case numbers down fast. So how do we get them down fast? What is the plan to get them down fast, or do we just have to ride this out to the end?
Well, if I'd had the authority more than a month ago, we would be all wearing masks and not suffering from so much of the harm that we're seeing. But that is no longer an option. And so I'm going to continue to promote and push as many people and as many businesses to ultimately wear masks inside when you're out of the home and in public. I will say, I think our businesses are doing a great job, especially the largest ones where many people may work on a floor or in an area, but we are to the point where encouragement is now key. Now, I do think that masking in schools is making a difference. It's certainly, we would not be where we are today without that. And so I'm grateful for all the school districts that are doing it. But now what I have the authority to do is encourage vaccinations, encourage masking, and then do everything I can to make sure that there are treatments for people who get COVID and that our hospitals have as much support as possible. All right, almost record time. I hope everybody has a good week. Stay safe, wear that mask, reach out to the person that you love, encourage them to get vaccinated. Your voice is the one they'll listen to. Thank you.